Hello, my name is Ed King. I am putting together a multi-part series discussing my brain tumor operation and subsequent recovery from said tumor. I've already done part 1 video. This is video part 2 discussing pain and medication, specifically while at home. I've already discussed in part 1 of the video what the hospital stay was like. So if you want to know more about that, just do a search for the name of this video, part 1, and you should be able to find it. It's also part of this series as well, so you should be able to find it on YouTube pretty easily. So today I wanted to talk about pain and medication and what that's been like since I've been home. There's several different topics I wanted to cover, specifically side pain, neck pain, staples and the removal of the staples, eye pain, steroids, pain pills, and pills for balance, and what my experience with all of those things has been like. So the first topic is side pain, and as I mentioned in part 1 of the video, when I was in the operating room, they put me on my side for about 6 hours. And this table obviously is not designed for comfort, it's designed for operation and allowing the doctors and the staff to be able to, best address the needs of the patient while they're doing surgery. So given that I am a heavier individual, I was on my side for 6 hours straight on a fairly hard surface, and that caused a significant amount of pain for me in my hip. So what exactly does that mean? So I had soreness while I was laying on my right side because they turned me over on my right side for the surgery to get access to my cranium. And so I was on that side for multiple hours. So coming home, obviously I was on pain medication, and that helped a great deal. But at night, especially for sleeping, especially when the pain medicine wore off, it was excruciatingly painful for the first week, and there was really nothing that you could do about it. Things like this just kind of have to heal. And eventually, I am happy to say that the pain did go away. It just took a long, long time. And it made it incredibly difficult to get a good night's sleep as a result. So I was tossing and turning most of the night, which is difficult in itself because my neck, being incredibly stiff, made it very hard to move without causing pain with that. But as I mentioned in video 1, I have a broken tailbone, and so laying on my back, I could only lay on it for a period of time before it caused too much pressure on the tailbone. And so then the only other option was to lay on my left side, which was where the incision is, and it required basically pressure on all of that muscle mass there. And so, as you can imagine, I was tossing and turning most of the night, and it took me a really long time before I can actually sleep through most of the night. So what can you do to help with this problem? Well, not a whole heck of a lot, but I attempted everything I could possibly think of, and really, pillows. Pillows make all the difference in the world. Having something to prop either on your backside or on your front to angle you at different angles, and which, believe it or not, helps relieve the pressure. So my first week at home, I had pillows all around me, just pushed in, propped in different places, just so the pressure points didn't hurt nearly so much. And the other thing I noticed was, especially when I was laying on my back, having the pillows under my legs helped a great deal as well, just so that it took some of the pressure just away from the hips in general, and that worked out quite nice. Other than that, that's pretty much all I can say about the side pain. It does go away. It's a low throbbing pain that just stays there for a while. The next item is neck pain. Now, this is something I'm still dealing with today. basically what one needs to understand when you're going into the surgery is that there's a lot of muscle tissue in your neck, and you don't really realize it. And when they cut this open and then stitch it all back together, there's a lot of stuff that's going on there. And thankfully, it didn't hurt so bad while I was in the hospital, because that would have been just incredibly uncomfortable. But coming back, especially as the painkillers subsided, and I was just taking regular pills to deal with the pain, it just began to hurt and throb. And you're healing. You have staples in your neck, at least to start off with. You have sutures under the staples, under the skin, holding the muscles together. The muscles themselves are just incredibly tight. So even when I first came out of surgery, just attempting to move my neck back and forth was just very painful. But over time, as the muscles began to heal, and the tissue is reconnecting and whatnot, it's gotten progressively better, to the point where I can easily turn my head from side to side without it causing any great deal of pain. And I can also look up and down without any great deal of pain. The stiff neck, though, I have to say, is incredibly exhausting. I'm like one of those people who pops their neck on a regular basis, and I can just do it just by tilting my neck in a certain direction. And it just felt like the pressure in my neck was so intense, I just wanted to pop my neck, and I couldn't. The muscle pain itself, though, the best way to describe it is a low throbbing pain. It's not the kind of pain where it just completely distracts you, but it's there, and it's there all the time. Especially if you look down or up or at any given direction for a period of time, and you move your neck again, it's like it will remind you, hey, I'm here. At certain points, I would look up and I would feel my neck just kind of twitching like this, and it would just keep doing that for a couple minutes. And so what I ended up doing was asking the doctor, what can be done about this? And you just want to use your neck. You've got to basically train your muscles to do stuff. Just keeping in mind, though, at least initially, you have staples in your head. There's sutures, and so you can't do a whole heck of a lot, and you don't want to do anything that will damage that. So I was just slowly turn my head left and right to a point where I would feel tightness or tugging, and go the other way, and just keep doing that, up and down. And eventually, as you continue to heal, you get further and further along with it. And it's not so bad now. I still have pain in my neck. I still get those throbbing points, and that tick feeling every once in a while, but it's not really so bad. But it does, I'm 3 weeks in at this point, and it does continue to hurt. I will wake up in the morning, and I will have to take something for it. And I usually will take something for it in the middle of the day, and usually before I go to sleep, just so I can try to get a good night's sleep. One main thing that has helped significantly with this, especially when it comes to sleep, and your neck is hurting, is a heating pad. I would turn the heating pad on low, and we have one of these kind that automatically turn off after a period of time, and just put it on the back of my neck. And the heating pad allows the muscles to relax and not be so tight. And it's one of the best things you can possibly do. If you don't have a heating pad, buy one. Best thing that you can seriously do. And that's pretty much it. There's not a whole heck of a lot more that you can say about this. The sutures eventually dissolve, and the neck heals, and you get further movement. But just don't overdo it. You don't want to cause any more pain or have them to go in and have to redo something. So the next item is staple removal. And this is one of those things that you don't know what it's like until you do it. People can try to explain it to you, but it's pretty straightforward, really. I went in 10 days after the surgery to have the staples removed. And what it is, they have this package, and they open it up, and it's like a pair of scissors, a little plasticky pair of scissors. And they go through and hit each staple one by one and snip it right down the middle. And then that causes the staple to break apart, and then they just take off the pieces that are kind of held into the skin, and for the most part, isn't so bad. It took about 10 minutes. They did not give me anything to numb the pain. They said, and this makes perfect sense after it was explained to me, it would cause more pain to put something, a needle, to shove it in and make you numb than it would just to have the staples removed. With an exception. So they got, I think I had 28 staples in my head, and they got down to the bottom 4, and the nurse could not remove them. They were stuck. And so she went out, and luckily my surgeon was in the office, and he came in and he was able to get the last 4. And I will tell you right now, that hurt. Brought tears to my eyes, kind of hurt. They just were stuck, and he just had to put some muscle behind it, and eventually they came off, but it caused a little bit of bleeding, but not like blood was running down my neck or not, but just a little bit, like I had gotten a little cut or something along those lines. The wound itself had already closed up at that point, so it wasn't like it opened up or anything. It just, where the staples had met the skin and where we basically tore those off from there, it just, opened up a little sore is all. I'd say the bleeding was done probably 2 minutes after that, at best, or at worst, I should say. The last pain I wanted to talk about is eye pain. As I'm sure you can see in this video, if I blink really fast especially, you'll notice that my left eye does not close all the way, and this is because of facial weakness. It was understood and expected going in, and if you watch videos, especially here on YouTube, there's a lot of people who have posted videos about their facial weakness or paralysis. And it's definitely one of the things I was most concerned about. And I told them I would rather lose my sense of balance and my hearing rather than to have facial paralysis or extreme facial weakness, because that's something that people can see, for one. And two, it really affects your ability just to not just socialize, but affects your ability to just do normal things. So when it comes down to it, the facial paralysis, or not paralysis, but weakness, because my eye doesn't close all the way, and I don't know if you can see, but there's a little bit of redness in there right now. And the redness is because where the eye's not closing, it's not staying moist, through the tears or whatnot. And it does cause a bit of pain, especially when I start getting tired at night. So what we've done is we've gotten some eye drops that are designed for extreme dry eyes. And we also have this eye gel stuff, which works really good. So I put this in at night, and this it makes your eye blurry, because it's a gel, but it takes away the pain. Your eye is lubricated, and it allows you to sleep through the night, which is really, really nice. And so this is, if you can tell, this is for severe eye relief. And like I said, it works really, really well. So that's all the pain points that I've had to deal with. So to recount, the side pain is gone at this point. Neck pain, still there, the low, dull neck pain. I take Excedrin these days for it. I don't take anything higher than that. I don't like pain pills at all. I don't like pills in general. The staple removal, it did hurt a little bit. They don't give you anything for it, but it's over pretty quick. And the eye pain. Your mileage may vary on this, of course. So the other items I wanted to talk about are the medicines, specifically steroids, Vicodin, and I can't remember the name of the balancing pill that they give you, but I didn't really take it all that much, but I'll get into that. So let's talk about steroids. Steroids are great for recovery, and they also suck for a number of reasons. Now, steroids are a necessary evil. They prevent any kind of inflammation in your brain and are essential for recovery. There are side effects, though, and that's the part that sucks. So what side effects are there? Well, I read on this in great detail and talked with several people who have been through this process before. And, they told me basically their horror stories. And to be honest, I didn't really experience them all that much. But I did experience some things. So here are the items. So bloating. I was very, very lucky not to experience bloating. Not at all. I drank a lot of water, and still do, actually. I like water. So maybe that helped, and I just kept my fluids running, and I didn't experience a lot of bloating because of it. Acne. I got acne, especially as I was coming off of the steroids towards the end. It wasn't bad at all, but that last week and the week after, as I was coming off the steroids where I wasn't taking them anymore, I started breaking out like crazy. I have never broken out that bad before. Not even when I was a teenager did I break out that bad. But basically, my entire face was just pimples everywhere, and on my chest as well. All you can do is just keep your face washed. I had lots of oil on my skin, which was really and highly irregular. So just regular face washes and stuff, and just try to avoid touching the pimples. Another item is the steroids make you hungry. While I wasn't famished in any way, I did notice an uptick in my hunger. Prior to coming off of the steroids, it wasn't bad at all. But right towards the end, when I was taking the last bit and actually got off the steroids entirely, and the steroids were coming out of my system, I got hungry. But I recognized what that was, and purposefully, I ate a little bit more, to try to satisfy some of the cravings, but I wasn't eating poorly. I was eating things like fruit, and low carb things, lots of proteins, to try to keep myself full. Nuts, especially. I'm a big fan of almonds, so I have a stack of almonds in my pantry here, and some meats and stuff like that, sandwiches, and that helped a great deal. So the coming off of the steroids, it's amazing how it messes with one's emotions. And I'm not really an emotional person. Things bother me, and I can get upset about it, but I'm not one of those kind of people that get incredibly upset or incredibly angry. I recognize that something is occurring, and I just try to deal with it. But I actually teared up on quite a few occasions coming off of the steroids, for no particular reason whatsoever. It's messing with lots of stuff in your system, and you just don't know how to deal with it, and sometimes you just gotta cry. So I did. And the last thing, these were probably the worst things about the steroids, was that I had the worst nightmares I've ever had in my life coming off of the steroids. And I tried to explain them to my wife and family, and just had a really difficult time doing so. It just, by the time I was up and got my mental capacity back, I knew where I was. The dream sequence was dying off, and I couldn't really remember the whole thing. But man, I woke up multiple times in the middle of the night, just, like I was afraid of pillows one night, and woke up, feeling like I was being suffocated by pillows, weird stuff. So that's definitely something potentially to look out for. So next item is the pain pill. So I was on Vicodin, which is, I don't know how people who do drugs do Vicodin or anything like it, because I can't deal with how things like this mess with me. It caused a significant amount of drowsiness, and I like being in control of my faculties at all times, and this just kind of made me just loopy, and finally I would just lay down and go to sleep because I hated how I felt on this. It caused my face to feel numb, And, this is prior to any kind of facial weakness. This was pretty much from day one. I would just keep doing this to make sure I still had feeling in my face, because it was just such an odd experience. After 2 weeks, I just stopped taking it. I was taking it 3 times a day, once in the morning, once at noon, and once at night, and it just didn't work well. I took it especially at night just to try to help me sleep a bit, but it just wasn't worth it. So I emailed the doctor and I said, I'm really tired of taking Vicodin, and I would like to move on to something that's not so heavy. Is Excedrin okay? And the doctor replied, yeah, at this point you're perfectly fine to move on to something like that. And I take extra strength Excedrin for migraines. I've been taking it for years, and I feel like it's working very, very well. It helps a lot with the neck pain, any head pain that I feel, because I do get head pain because of the neck pain. I failed to mention that before, because the muscles have been so tight. It just feels like sometimes that everything is just tight and causes headaches. But that's getting better, thankfully. But yeah, the Excedrin really helps out a great deal with just about everything, and it doesn't affect your system nearly as bad as what this other stuff does. The last item is the pill that they gave me for balance, and I have to tell you, this thing did nothing for me. I stopped taking it after a couple days, because not only did it cause drowsiness on top of the drowsiness that the Vicodin caused, but it didn't do anything. So why take it if it's not going to do anything? And what I ended up finding out was it was actually good that I stopped taking it, because going to physical therapy, it affects your ability to do therapy correctly, because it's compensating for balance, which is obviously what it's designed to do. In physical therapy, you need to basically be at a proper baseline so that they can see where you're currently at and be able to get a true reaction. And because you're taking this pill, it doesn't give you the proper, or give them a proper reaction for what it is that you're trying to do. So that pretty much covers it. When it comes down to it, pain for the entire surgery, not bad. When it really comes down to it and you really sit and think about what's happened, I had a hole drilled into my head, and they pulled out a tumor, or cut out a tumor. I will gladly take this pain and the discomfort for a couple weeks and just deal with this, rather than having to deal with having a tumor that can cause a lot more damage. So it's all relative, right? You want to make sure that you understand what you're going into, but ultimately these things that are after the fact are so insignificant in the long run that it's worth it. So while I want you to understand that it's difficult to deal with these things, and it can be tiring and it can be exhausting, very exhausting, it's worth it, hands down. As before, if you have any questions, comments, concerns, please feel free to reach out to me. You can either leave a comment below, or if you are watching this through Facebook, please feel free to contact me on Facebook or via email. Thank you so much for your time, and I hope to have the next video, which will be about vertigo, up in the next couple days. Thanks.